Trust me when I say this, but we as frontline workers, we're exhausted. We're completely exhausted.
We're just not on a verge of a physical breakdown, but a mental breakdown as well.
It's been 11,538 hours since the day India reported its first coronavirus case. It's been equally long since we last hugged our parents, because we are so afraid that we might just end up giving up the infection to them.
Where I was doing COVID duties, all I was seeing was daily deaths. The faces of the bodies, the deaths, they haunt you at night.
We are really risking our lives, risking the lives of our families, and coming to work every day, and in the bargain we do not even manage to save the lives of our own loved ones. So this is a really, really devastating situation out there, and I want everyone to understand what we healthcare workers are going through as well.
Most of us have lost a family member. Most of us have lost a friend. Most of us have gotten ill ourselves. We are seeing deaths on a daily basis, and it just wreaks havoc on our heads. We're not okay at all.
It's not just COVID, it's not just seeing patients dying every day despite you doing your best, but it's also that we are humans and we also have families.
We stand strong at the front line of this pandemic in the eye of the storm, at the cost of our physical, mental, emotional, and social well-being.
A colleague of mine lost his father due to COVID, and he was on duty when he lost his father to COVID, and did not even realize that he lost his father until and unless he came out of the PP and checked his phone, and then he saw missed calls and messages of his family.
So many of my colleagues, they're taking antidepressant pills, they're taking anti-anxiety pills, they're on therapy, just because it's not easy for us to cope up with the crisis of this scale. We're human beings too.
Seeing people run from pillar to post to get a hospital bed, a life-saving medicine, or something even as basic as an oxygen cylinder. It's particularly not been easy for us to see people as young as us die in front of us. It's not easy to look into the eye of their parents and tell them that their son or their daughter is no more. They were numbers for everyone else, but they became names for us. And those names have now become faces, and these faces are going to stay with us for the rest of our lives.
I have been a COVID survivor myself, and I have spent 15 days in an ICU. I am an asthmatic, and I still work. I show up to work every day. I still work in a COVID facility.
We've been hit both physically and mentally. We are overburdened and exhausted.
Every night when you go back to your bed, you think, what else could you have done to save this patient? What else? And what else kills you for days? Now it's not even about the physical exhaustion of the wearing the PPE and all. Now it's just about the mental stress, the mental exhaustion of dealing with deaths and not being able to save someone because COVID is just so bad.
I have lost my loved ones in the whole bargain and not been able to attend my own grandmother's funeral because I was tested positive and was admitted in the ICU at the same time. So we are also fighting battles of our own, which we really don't talk about. But I think people need to know about this, that we are humans at the end of the day.
So in the months of April, when COVID was completely set in, the second wave was at its peak and Mumbai was having a terrible time dealing with patients, no oxygen, poor oxygen supply, no ventilators, no ICU beds, no remdesivir. All of this created a havoc in the city, and it was getting to the healthcare workers, us doctors working on the front line. Imagine telling an 18-year-old boy that we cannot save his father just because there is no O2 supply in the hospital and we cannot admit him. How difficult it is to bear the load of telling a child that we cannot save your father because of something as trivial as oxygen not being available. almost like a month back, I was in the ward and I had just entered the ward. I just entered my duty, and a relative comes crying to me that, doctor, please save my father. He's dying. And it was entirely a COVID ward, so I'm assuming the patient was COVID positive. I was like, I need to rush, no PP, nothing, just a simple mask. I ran to the patient. I realized he's collapsing. And within like 10 minutes, he died. And the cause of death was obviously COVID, and a respiratory failure set in, and he died. I was not prepared for this. I did not wear my PP. I just went just because, assuming that if we don't do our duty, then who else will?
Right from 15-year-old osteosarcoma patients to 93-year-old aunties who do not even remember their own names. They've all fought COVID, and at a time when their families are not with them, we have become their families. We have wiped their tears. We have held their hands. We have hugged them. We have not stigmatized this disease. We have not abandoned them. As doctors, we are trying our best to save lives, and our hands are tied because we can only do so much without resources.
I still think about the lost lives, and it is so mentally taxing, you can't even imagine. So I just think time will heal, and let time tell how to deal with it, because I don't have an answer to this. I'm sorry.
I don't think that we're gonna come out of this pandemic in the same state that we once entered it last year.
Our COVID ground reports cost us about 7.5 lakh every month. You can help our reporting from the ground. Go to thequint.com, click support the Quint tab, choose a plan and pay.